The next contestant will be from Brea Olinda High School. From Brea Olinda High School, we have Erin, Chen.
Good afternoon, everyone. My name is Erin Chen. I'm a senior at Brea High School in my first year of sports medicine. I'm also a finalist for the Dick Nelson High School Athletic Training Student of the Year. And today I'll be breaking the ice, evaluating common injury treatment methods in sports medicine. The two main topics I'm going to be focusing on today are cryotherapy being used for injury treatment and evaluating taping techniques. Does anybody know who this man is? Any guesses? Okay. Does anybody know who created the acronym RICE? Gabe Morgan, yes! So Dr. Gabe Morgan created the RICE acronym in 1978, and it was a protocol that he recommended athletes use after acute sports injuries. He recommended for them to rest, ice, compress, and elevate their injuries as part of recovery. Who here has iced their injuries before? So that's like the majority of us, and that's largely because of Gabe Morgan's acronym. RICE became the golden standard for injury treatment in the whole field of medicine. Doctors, nurses, EMTs, athletic trainers were following this protocol in treating their athletes and their patients. It was one of the first steps that they would go to after their patient or athlete experienced an injury. But was this the right thing to do? Because the known effects of ice are that it is a natural analgesic and a vasoconstrictor, so it decreases blood flow. But the traditional beliefs surrounding what ice did and why people were using it was because they thought that it was reducing their pain, but also reducing inflammation and reducing edema. But this assumption that inflammation is bad and something that needs to be stopped is incorrect, because inflammation is a good natural process and it's the body's way of healing itself. When the inflammatory process occurs, it introduces these cells called macrophages, which prepare the tissue for the next two phases of healing, proliferation and remodeling. So when ice is applied and inhibits the inflammatory process from occurring, it disallows the body to heal itself. And similarly, edema is not innately bad either. It is simply the accumulation of interstitial fluid between the cells. And the only way in which this edema can be removed is through the lymphatic system, which works passively by the skeletal muscle contracting and compressing those lymphatic vessels to evacuate that fluid. When ice is applied, it has no effect on the lymphatic system's ability to evacuate that fluid, and therefore does not assist in reducing edema. One study conducted in 2011 by Nardis, Pelosi, and other researchers looked at a group after a muscle injury. One group received ice for 20 minutes right after that injury, and the other did not. Within just a few hours of that initial injury, the group that did not receive ice was already showing signs of having those macrophages, the cells that initiate the inflammatory process, whereas the group that did receive ice had no signs of these macrophages present. And 3 days after that initial injury, the group that did not receive ice was showing signs of regenerating muscle, whereas the group that did receive ice had no signs of this regenerating muscle. And 28 days after that initial injury, the group that did not receive ice had 65% more regenerated muscle compared to the group that did receive promoting the healing process, rather it delays it significantly. So while ice can be an effective pain reliever, it should not be used to reduce inflammation, and it cannot be used to reduce edema. And in 2015, 37 years after Dr. Lee Merkin made his original claims, he rescinded them, suggesting that athletes avoid the use of ice if their goal is to recover as quickly as possible. Rather, athletes should be encouraged to remain mobile because movement is medicine. They're encouraged to increase their mobility, their active range of motion, their strength through progressive resistance exercises, their flexibility through passive range of motion, and their proprioception, which is the balance of their body's awareness in space. And once these athletes are deemed ready to return to more functional movements, a common practice is for athletic trainers to take them supportively to help reduce the risk of re-injury. And the most common way in which athletic trainers will do this is through the use of pre-wrap. Pre-wrap is just a thin foam layer that is pretty stretched and it doesn't provide any support itself. The support comes from the rigid tape. So my question is, why is it so common for athletic trainers to be using pre-wrap when it's not helping to support the athlete, when the goal in taping is to provide support? And when I was looking this up, researching it, I was met with a lack of any discussions, articles, research, studies comparing pre-wrap to no pre-wrap, and any athletic trainers explaining their reasoning. It seemed like everybody was just following what their teacher had taught them and not researching it. So I decided to conduct my own little informal research where I polled 448 athletic trainers nationwide, asking a couple questions related to this. The first one being what they think would provide the most support for an athlete returning to play after an injured ankle sprain. The options were to either tape directly to the skin or tape to pre-wrap the skin. And a slight majority, a little bit over 55% of those 448 athletic trainers answered that taping directly to skin would provide the most support. The next question I asked was, do you typically use pre-wrap? And an overwhelming majority of over 96% of these athletic trainers answered that they do use pre-wrap, despite a slight majority thinking that it hinders the support of the athletic tape. I also included a section for them to explain their reasoning, and I was met with a wide array of different answers, with one of them citing worries about skin infection that might occur from hair removal that the athletes might perform. Athletes worry about pain that might occur from being taped directly to the skin, or wounds that might arise from the tape being removed if it were to be applied directly to the skin. So